couple of technical difficulties. Well, welcome today. We're glad that you're joining us today. I'm Dave Lowe. I'm the Director of Government Solutions with Criterion, and we have with us Jim Weltz. He is the President of Criterion. Say hey, Jim.
How you doing? Thanks for coming.
Awesome. Great to have you folks here. Real quick, some housekeeping items. If you have questions and comments, you can open your panel to the right-hand side, and you can chat those questions, or you can ask questions using the questions panel. And if you would, make sure that you put your audio pin in so that we can unmute you. We love to have dialogue. We'll love to be able to incorporate you in the conversation as we talk about Legionella prevention and mitigation. So while you're here, when we ask the folks the truth about the disease, you want to know what's happening with this, how it's contracted, how to prevent it, and some of the symptoms. We'll talk about those things. You need help with VA, CDC compliance, testing, mitigation, and the paperwork for compliance. And everybody just loves paperwork, I know that. This would be the best briefing ever if it was brief. And we do know what time of year it is. A lot of the folks that are joining us today are from the procurement side, and we know that it is the throes of the end of the fiscal year, so we will keep this as brief as possible. There's a couple of folks out there that we know that have requirements for this. If it's concise, obviously getting back to that being on point, and if it helps with solutions, and if we could provide testing, and we can certainly do that. Criterion is in the business of providing that testing and addressing those things. Just a topical overview. We'll be talking about public perception, and a lot of this is being driven by that. The whole reason why we're even talking about this right now, and I was on the phone with Dr. John Daig from the VA Inspector General's office, and we were talking about that public perception, and Karen Rasmussen and her group that are also involved. I'm not sure if they've joined. They're going to be joining us. We'd love to have them here today. If they pop in, we'll try to highlight them. So if you're with Karen's group or Dr. Daig's group, please let me know, and we'll make sure that we include you. There's directives that are out there that have been out for the past, actually the past 30 years as we've been working through this. Certainly want to include any of that. We'll talk about some of those things. We have the VA information letter as well as the OIG inspection reports and CDC guidelines. We'll give you a high-level overview of Criterion and what we do. We'll talk about Legionella in the news. As I mentioned before, the public perception on this is pretty intense at times. It's starting to bubble up again. The impact of that news on VA facilities, the mandates and memoranda as a result of those, some of the testing, training, and remediation that you can do to prevent these things, and we'll also get into a question and answer session and our closing remarks. So if you would, again, just make sure that you have things put into, if you have any questions, feel free to ask those in the panel. A little bit about Criterion. Founded in 1986, we're addressing occupation and environmental health issues. Jim, if you want to expand upon this just a little bit about what these occupational and environmental health issues are in just a second. We'll talk about those. And there's 11 industrial hygienists, 2 certified industrial hygienists. We do have state-of-the-art monitoring and testing equipment, and we have a lot of experience in challenging environments, including Legionella testing and its mitigation. So tell us a little bit about Criterion and how you got started and the types of services that we have that we're looking at here.
Well, I started the company in 1986 with a small number of clients that I had worked with when I worked with in an insurance company. But anyway, as an industrial hygienist, my job is to recognize, evaluate, and control occupational disease hazards. This can range anything from, say, heavy metals in welding fume to solvent vapors in a degreasing operation to formaldehyde, or well, it used to be, it's not longer used, but formaldehyde, say, in a morgue. But any place people work with or are potentially exposed to injury causing agents, our job is to try to, like I say, recognize, evaluate, and control that.
Right. And a lot, obviously today at the top of the list is Legionella testing and plans, but asbestos, lead, mold, all those types of things are things that Criterion is responsible for. And you also do some real estate type transactional work with Phase 1 and Phase 2 in environmental site assessments as well, right?
Yes, that's correct. To the ASTM standards.
The ASTM, right. So anything that revolves around testing, especially indoor, we're usually part of. Some of the things that you'll find for our certifications, one of them is very important right now, the CDC's Elite program. We're certified in that. HHS, we have a myriad of different accreditations to be able to help for these environmental microbiology, environmental lead, industrial hygiene, all of these lead-safe things. And so if you need any of these services, we can also provide those. Some of our federal customers, obviously VA, while we're talking with you folks today, everybody on this call is dedicated to the VA, but we also work with HHS, the National Park Service, TSA, Army, and Social Security Administration, so we do understand the federal side of things, and we certainly want to be able to help you in any way we can. What we're seeing today actually goes all the way back to 1976, and this is where, for those of you who don't know, the American Legion, the Bellevue Stratford Hotel in Philadelphia, not all that far from where Jim and Criterion are located. There was 25 folks that died. Tell us a little bit about how this happened, Jim, and why it became such a national issue.
Well, how it happened was that they had a cooling tower. For those of you that aren't familiar, cooling tower is simply a device, it's usually on the roof, that kind of splashes water around in order to cool it off before it's put back into the chilled water system for cooling a building. When it splashes the water around, some small droplets become airborne, and they were very close to the intake of the air handling system, the HVAC system. And
which pulls air from the outside and brings that air right back into the
building, yeah. So along with this air that it was bringing in, it brought in these water droplets that were that contained Legionella bacteria, and a whole lot of people got sick.
Yep, and there was it was a national tragedy of sorts, and it got a lot of attention. And even to today, there's 8,000 to 18,000 cases per year that are reported to the CDC. And you mentioned this the other day in the briefing, and that is that you don't have to report one, but you have to report two, right? Is that right?
Yeah, if you know that you have 2 deaths from Legionella bacteria, you need to report to the CDC.
So those numbers that you see there are, well, they're still
probably low.
Right.
The situation is elderly people. It's not uncommon for them to die from respiratory distress, pneumonia. And these things are actually symptoms. What has caused the respiratory distress or the pneumonia can be very many things. The only way you can tell if it's Legionella or not that was the reason, you have to do a culture swab of the lung tissue itself. This isn't done in most cases until there is some statistical anomaly. For example, if they expect, say, 1 death per month, and suddenly they get 3, well, then maybe the CDC, then people start looking around for an unusual or a local environmental cause when they hit certain statistical criteria. So these tend to be underreported.
Yeah, and sometimes these can actually be driven by events where it becomes part of the news again. And some of those that you'll find as we're talking about, if there's events that happen within a particular facility, and we had an incident out in Pittsburgh at the end of last year, which there was that statistical anomaly popped up, right? So here we had a facility in Pittsburgh where it crossed over that threshold, and they started to test for these things, and we find that that there was an issue with Legionella in one of the VA facilities, and this has brought on suits. It's brought on other linked deaths of folks that were in that hospital. And what happens is that then this gets part of the radar. It gets put on the radar, right, Jim? So all of a sudden
Yes.
people are kind of paying attention. And now here we have, it's not just Pittsburgh, and it's across the nation, and VA hospitals in trouble. And this is the type of things that start to bubble. And this is what gets folks in front of Congress or in front of a committee, and the next thing you know, you have disciplinary action that's happening as a result of an outbreak within a VA facility. And this is hitting the news all over. It's not bubbled up to the top where it's created that national presence as it did back in 1976 or other times when it bubbles up. But what happens is it only takes one more, and the next thing you know, it escalates to the next level. But we see it on CNN, we see it on ABC, we see it on CBS and NBC. So these are the national news organizations that are linking the VA to a particular problem. So what we have is really a public perception problem within the VA, and it presents several different concerns and impacts on the VA facilities that you're part of. The patient concerns, obviously, we don't want to have patients that are being infected by Legionella in our facilities in the VA. So we certainly don't want that. And what that does is it rolls into public perception of the VA and whether or not it's safe for folks to go there, and that creates additional problems with public perception, obviously, and then getting into the disciplinary action resulting from that if the facilities are not doing what they're supposed to be doing, and that's one of the reasons why we're here, is it's kind of confusing about what's happening out there and what is really required. So we're going to be talking about that as well. And then obviously wrongful death suits that wind up dragging folks through the court systems, and we don't need those kinds of things. So being able to identify how we can address these to enhance the public perception, which helps to deal with the patient concerns as well, and removes all the disciplinary action and suits. That's the objective. The objective is to prevent these things from happening from the beginning, and we're going to be talking about specifically some of those pieces. Jim, tell us about some of the mandates and memoranda that are out there regarding what the VA has put out about Legionella over the years, as well as what's happening right now. What's the most recent things? What can you tell us?
Well, the most recent that I have is the Undersecretary for Health Information Letter of Prevention of Legionella Disease. It's IL 10-2013-006. And this one's quite good, actually. It's short, and in one page pretty much summarizes everything that should be done at a facility to prevent Legionella. There are some other directives, but look at the bottom. If you go to the web to find these, look to the bottom to see if they're expired. They still may be worth reading just for their content and in order to learn about Legionella. Also, the main document is from the Department of Veterans Affairs, Office of the Inspector General, Office of Healthcare Inspections, called Prevention of Legionnaires Disease in VHA Facilities, and it was published on August 1st of this year. It's about 45 pages, but it is pretty much what they go by in order to judge whether or not a facility is up to snuff, so to speak, in preventing Legionella.
And we'll
the other,
go ahead. Sorry, go ahead, Jim.
No, that's okay. I pretty much have it.
We will be providing links to these. We'll send the documents. We'll send links to the documents so that you don't have to go trying to find them. We'll certainly be able to provide those. But I think what's really important is that some of these were written many years ago, but they do have implications of what's happening today. And when this is brought up and becomes an issue, the biggest thing for the facility is to make sure that they're keeping their records and making sure that they're doing what they're supposed to and keeping those records, so that if there is an issue, you can show that you're in compliance with these directives and these mandates. Right, Jim? Isn't that the idea?
That's correct. Yes.
Super. So just a little bit about this. Can you tell us about the bacteria itself?
Okay.
How does it get created, and how does that work?
Well, I guess it was created a long time ago, but it'll survive in water from 32 degrees Fahrenheit to 145.5 degrees Fahrenheit. It lives on the protozoan animals that exist in pretty much all water. Even heavily chlorinated water will have some protozoa in it, and whether it's alive or dead, the Legionella doesn't care. It'll eat it. Biofilm is for want of a better word, scum that builds up on the sides and bottoms of water containers, and they can be many different types of life forms, including algae, and this bacteria will live on those. Above 158 degrees Fahrenheit, it's killed instantly. These guys would be killed instantly, but unfortunately scalding occurs at 117 degrees Fahrenheit. So one of the ways of prevention is to heat up hot water tanks to 160, leave them there for a few minutes, and then cool them down. But you have all kinds of other issues with patients in the room. So it gets a little more complicated than that. If you can do that, if you can heat your hot water tanks up to 160 degrees and you don't have any other issues, that's the best way to go. A lot of other people will have it at 160, but then they install mixing devices that mix cool water in with the hot at the outlet, so the person isn't scalded. But the hot water seems to be the preferred way to go. Permanent ways, such as copper, silver, or chlorine dioxide, are much more expensive to install. They must be maintained and resupplied, but they are extremely efficient. The other part is in preventing is to inspect your facility for, it says here, open decorative water features. But I'd also look for humidifiers, in particular the humidifiers that mist as opposed to heat up to a vapor. The misting humidifiers cause all kinds of problems and should be avoided for a lot of reasons. The clinical community at the facility should be have their antennas up for blips or spikes in the number of respiratory problems, and keep Legionella in mind. The whole thing with prevention is tied together with a written plan, and that is required by the Veterans Administration policy. With any kind of governmental regulatory action or requirements, if you don't have it written down, it didn't happen. So you could be doing the best program in the world, but if you don't document that, it's like it never even happened. So the written annual Legionella plan needs to be done, which requires a committee from the, well, I think we'll get there later. It's a collaborative effort.
Yeah.
Yeah, right.
Where you have multiple people that are involved in this process. And you mentioned one thing, and that is the requirement is an annual type of report and documentation. And now each one of these folks are involved, or are there people that work for them? Is it required that all these folks are involved, or can you? What's the process?
No, it's not required that all of them. But for example, you see there facility director and chief engineer. Well, the chief engineer may report to the facility director. Facility director, I wouldn't think would be there, but hopefully he would have someone from his department, someone with some authority to initiate some actions on the committee. Patient care services needs to be involved so that any action that is contemplated can be considered along with what effect, if any, it would have on patient care, which is certainly very important at a hospital. And the infection control people should be involved. I know in hospitals, getting various departments together and working together is more difficult than your average organization. I realize that, and that's part of what Criterion does when given a list of potential people. We can spend the time and communicate around to various people and round up a committee and get them to agree on a date. Believe it or not, that's a very important part of the service as much as monitoring.
I imagine so. You got 5 different areas here, and they're all getting pulled in different directions for different reasons, and just making sure that those pieces actually get assembled and done. And that's almost like the beginning part of it, so that everybody knows what their roles are and being able to do that. Tell us a little bit about the testing and training and remediation. Where, you know, a lot of times people ask us, do we do the soup to nuts? We do the soup to nuts sometimes, but most of the time we're involved in the front end of that, assembling the group, saying how many places do we need to test? What are those types of things? And we do the testing components of that, right?
Yes. For some reason, that people tend to look to testing results. One of the if a problem developed, one of the first things someone is going to ask is, hey, did you test for Legionella? Did you test the water? And if you haven't, it's going to look bad. The other side of the coin, if you test, sooner or later you're going to find it. This stuff is all over the place. It's a question of who is inhaling it and how much they're inhaling, but the bacteria itself is not as rare as people seem to think. So testing where positive hits are found, a treatment such as turning up the hot water and making sure the hot water is above 160 degrees and it runs through the system for 2 minutes, would be one, and then documenting that would show we tested, it was high, we killed it. That sort of thing. We will train people, maintenance people, in everything and anything from even collecting the samples and sending them to the lab if they want. We can come and collect the samples. Samples are generally water, from the outlet, wipe samples of any biofilms that are found, and sometimes air samples are collected.
Okay. Now, there's a question here about, John says, I've looked into this for our facility and it's confusing. What are the VA requirements for testing and mitigation? And I think that's part of this, is that this slide here helps with that, because this kind of directs us, doesn't it? The IL 10-213-006, isn't that one of the ones that you mentioned before?
Yes, it is, and it does address it. It does not give specific numbers, but that can be decided along with some reason and or logic. And there are various places you can find that have recommendations as to numbers. That could be relatively easily decided, in a meeting, how many you're going to.
And what do you mean by numbers when you say numbers?
Well, you certainly, if you wanted to test to see if your water system had Legionella, you wouldn't test every water outlet in the hospital, just simply for budgetary reasons, and there are too many. The Legionella could be growing and coming from anywhere in the system, from the hot water tank to, say, a shower head. Shower heads are notorious, and in my opinion, the worst offender. If I were going to put in a program that was, and I had to limit it to one thing, I would limit it to shower heads.
Really?
Yeah, from within the head. But this, in the immediate or the beginning conference with the various concerned people and the people that are charged with this, a plan of testing and remediation would be put in writing, and it would simply be a matter of just following along. Test. If you get any positives, this is what you do. No positives, don't do anything.
And so what part of that is, and that gives you your documentation that you'll have ongoing, so that if there is an issue that comes up, you have the documentation of what you've been doing, what you've been testing. The fact that this group has gotten together on a regular basis, even if it's only annually, that's regular enough to be able to say, okay, here's our plan, are we executing our plan? And as long as there's no deviation, like you said, Jim, if there isn't a problem, you don't have to go do a whole lot of things. But if you wind up identifying it, then you can go, depending on the risk, right? You can start to build that. And each one of the plans really needs to be done around each facility. There's no like cookie cutter, is there? You have to look at how the facility is designed and how it's laid out and all those things, don't you?
Yes, you do. The plan would have to address a facility, and if you picked up a plan that was, say, some kind of cookie cutter, not that you can't start out building a plan from a boilerplate type outline, but if that's what you had was a cookie cutter type plan, it would be immediately seen for what it is and kind of meaningless. You kind of have to spell out, what rooms are going to be sampled when, and you have to give them room numbers. It's got to be tailored to the facility.
Okay, that's important to know. So you mentioned some of these before. The remediation, after you test and you find out that there's some level, and like you said, eventually it's going to pop up because it's not as uncommon as everybody thinks. So these are some of the things: the thermal eradication, hypochlorination, copper silver ionization, chlorine dioxide, and one of those that which one do you kind of gravitate towards to say, okay, if you have the budget, you go here. If you don't have the budget, you go here. But I think thermal eradication has some problems with pipe expansion and things like that, doesn't it? If you're going to crank your water heaters up that hot, if it's not normally that hot, that can be a problem, can't it?
Well, if it goes up to 160, there are problems with it. That's one of them. The most serious is that, or the biggest problem with it is, you want to heat up the hot water and then run it through the system, which means send it to the outlet and spill out into the sink. Now that's against regulations to run water that hot in an occupied patient room.
Right.
If there is room turnover, sometimes people have successfully done it that way by testing certain rooms when they're evacuated. But that's more difficult. You have to have point of those hot water heaters that are right in the room. But thermal eradication does have its problems, including I've seen some people crack. They run the hot water into the sink and it cracks the sink.
Oh man!
You have
yeah,
to
I can
make
see
sure
that.
you run some cold water in there with it. But thermal eradication is the method of choice, but it does have problems. If you have the budget, these other things like hyperchlorination I don't particularly like because just for the odor.
Right.
The copper-silver ionization and the chlorine dioxide, both of those are very expensive to install. And then, of course, there is ongoing maintenance and supply, but they're very, very effective, and would be the
How
way
about
to get
filters?
it. I'd stay away from filters. They don't get changed; they get dirty, and then they turn into little. I almost guarantee if you put them point-of-use filters, that someday somebody's going to find Legionella on the filter.
Yeah, like a colony.
Yeah, it's
You're catching them all together. It's not because the filters don't kill that, right?
No, I think they're trying to catch it before it comes out, and it sits there with all the other crud that was caught by the filter, and it could be in little Legionella heaven.
Right.
But yeah, I would avoid point-of-use filters.
All right, let's open this up to questions from the folks, and we'll take a look at. We had one from John earlier. Hopefully, John, we can talk about that a little bit more. I know you don't have a microphone on your computer, so you can't talk to us. But let's see. First question: will this presentation be made available? Yes, it will. We will include links to all of the different documents that we've been talking about. We'll have a link to the video itself so that you can replay it, and we'll also have a presentation. The PowerPoint presentation will be available for download. So that is part of that. Here's one. Are there examples of how other facilities are obtaining these services? Yes, we do actually have. We're working with the VA in where is that in Pennsylvania? I keep forgetting.
Cokesville.
Cokesville. Where's Cokesville?
It's just west of Philly.
All right. So, and for that, Criterion is tasked with is it 60 different testing points? Is that what it is?
At 60 different samples, yeah. 30 outlets, and then there's 30 areas where we're going to do what we call surface samples of biofilm. And then they're probably going to roll this over into a semi-annual or an annual type thing so that eventually they'll cover everything in the hospital and then just keep rolling along that way. And any time a problem is found, whatever the particular problem is, that will to some degree dictate what kind of remediation action we take.
And as far as procuring this, that particular one was a firm fixed price, so that there's many different ways. I was actually talking with Stacia Nunn. She handles Oregon, Washington, Idaho, and Alaska. If you're in that region and you need these services, she would prefer that you contact her so that we assemble a group of people. She wants to either do a blanket purchase agreement or a single PO. So whatever the way, instead of negotiating this individually. So real quick on that, I wanted to make sure we made note of that. Another question, can you provide a sample scope of work? Yes, we can do that. We'll be putting that out as part of the as the presentation follow-up. You'll have a link to a sample scope of work that we can assemble for you. Any other questions about the disease itself or the prevention of those things? We'll get into a little bit more of the procurement side of things in just a moment. Anything else that you guys would like to know? If you have any questions, again, please just ask those, and we'll be glad to include those, and we'll do those. Some of the procurement options. Criterion is a small business. Here's our cage code, our DUNS number, and we do have a GSA contract. that you can purchase these services off of. We have the ability to, we'll be glad to help you in creating a BPA if necessary, so feel free to reach out to us for that. Some of the popular NAICS that this falls under is environmental consulting, testing laboratories, remediation services, and other things as well. So if you're looking to put something out for this, whether it's with Criterion or anybody else, these are the popular NAICS being used. These are the ones that we are certainly signed up under, and we can certainly help with those. We will be providing, as I mentioned a couple of different times, links and more information from the CDC, the health information letter, the directive that is expired, but it's still pertinent information. A lot of things were built on that. For that, the one that is most important right now is IL 10-213-006, and as well as the information from the Inspector General on August 1st, 2013. We have some examples of the testing reporting there, as well as our capabilities and our GSA schedule. You can remember Criterion when you have, obviously, we've been talking about the Legionella components, but we also do asbestos, mold, and monitoring remediation of those items, lead materials, indoor air quality surveys, water testing obviously is part of that, noise testing and remediation, and phase 1, phase 2 environmental site assessment. So if you have any of these that come across your desk, we'll be glad to be part of that with you, and would love to be able to work with you. Any additional questions and comments? We're down to the last couple minutes. I just want to make sure that we include everybody. One from Sarah, will the presentation be sent out? Yes, we will send those presentations out. Again, we will provide the sample scope as you asked for. Any other closing comments from you, Jim, as to any last minute advice or anything else that you'd like to share with the folks that are joining with us?
Just that, you know, the sooner you start moving on this, the better. You don't want something to happen and then start running around answering to, besides the Veterans Administration, answering to your local Action News team. But, anyway, so that's pretty much all I have.
Yeah, and staying out of the limelight, Jim and I were talking about this earlier before, and that is that you don't get any real credit for being able to determine the people's lives that you saved, because there's no way to be able to tell if they would have been infected. There's no way to know the number of lives that are saved by implementing this. And it's only when something bad happens that you wind up in front of the news. You can't get up and say, hey, nobody in our facilities died in the past 25 years because of Legionella. That doesn't work. It's the nature of how these things break out in the public perception of those things that we're trying to help mitigate. Certainly patient protection, number one. Agency reputation, however, is very important, because agency reputation can preclude you from being able to even service some folks if they're afraid to come, and then the implications of that. So we do really appreciate you joining us. These recordings will be made available, and we will absolutely include you in that follow-up. Thanks for joining us today. Oh, wait a second. We have one more question. What are the recommended hyperchlorination procedures? AWWA ASHRAE. That's from Dan Davis. Hang on one second, Dan. I'm going to unmute you, and we'll talk about this. Dan, are you there? That we can talk, or is it only by text? Jim, do you understand that question? What are the recommended hyperchlorination procedures?
Yeah, I understand the question, but I don't know, and I will find out. I know various agencies have standards for this, and who is required by the VA, I don't know, but I will. Okay. Find it.
The two organizations, I recognize ASHRAE, AWWA.
Society of Heating Engineers.
Yeah, and AWWA. So we will get back to you on that, Dan, and make sure that that information is included. Any other last-minute questions? If you do have any questions that you would like to have answered that you want to take offline, please feel free to hit us. Here's our email addresses and our phone numbers. We'll be glad to talk with you about it. And we do appreciate you joining us today. Enjoy the rest of your September, especially those in procurement. I know this time of year is crazy, so we can certainly talk about this after the 1st of October. If it's not a pressing issue, if it's pressing, get in touch with us right away.
And the person that asked Dan, it's ASHRAE is who they recommend. Okay. They reference ASHRAE. Okay, there you go, Dan. We got you that answer. So if there's any other questions, feel free to do it. We are past time. We're over by 2 minutes, and I want to be respectful of our time limit. So please reach out to us if you need us. Thanks for joining us today. Thanks, Jim. We do appreciate you having you on today.